Hi, everyone. I'm Nicola Partridge. I lead commercial strategy at IQVIA Digital. I am so excited to be moderating today's panel. I'm getting a hint of data, lessons from the wine industry. I would love to introduce each of our panelists to introduce themselves.
Hi, everybody. I'm Marinda Kruger, and happy to say that I'm the VP of winemaking for First Leaf. I have a PhD in wine. How cool is that?
So cool.
So cool.
And I've brought notes, not that I don't want to forget anything, but when I start talking about wine, I just don't stop. So this is like...
That's okay, we have an hour.
59 minutes. Okay. Why am I going after you? Head of winemaking, PhD in wine. Okay. I'm Oz, head of digital marketing at Genentech. Happy to be here. Disclaimer, I don't wear hats and panels, first time. Also, we were at a wine tasting session led by me and my friend Carly right before this. So if I say anything that doesn't make sense, it's the wine, not me.
Hi, everyone. It's a pleasure to be with you all today. I am Melissa, the Chief Client Officer for CMI Media Group.
Yeah, thanks for adding that disclaimer. Half of us were drinking wine about 10 minutes ago, so welcome to the post-lunch session. So you might be wondering why you're here and what a commercial strategist, a pharmaceutical marketer, a data science and wine expert, and a media advertiser have in common. It's not just our shared love of wine and expanding our palettes and knowledge and sharing it with all of you and maybe showing off a little bit, as Oz likes to do. It's that we are all completely obsessed with data and the power of data to deliver amazing customer experiences, no matter what industry we're talking about. It's no secret that the pharmaceutical industry is heavily regulated and certainly lags behind many other consumer-facing industries when it comes to our ability to use customer data and consumer targeting and all that kind of thing. But that doesn't mean that we can't look outside of healthcare to other industries and adjacencies to understand, okay, what are some innovations or new ways of thinking, new ways of taking data and new technologies, whether it's AI or not, to deliver those enhanced customer experiences. Wow, I'm really flowing here. This is like, you can hear the wine. And before I go on, I actually want to know a little bit more about who we have in the audience. So I'm assuming that there are a fair number of healthcare marketers here. Put your hands up. Okay, cool. That's about 65% of the room. Any wine industry people? Yes, we have. We have First Leaf represented here. Okay, so any other like heavily regulated industries in the room? Where do you work? The beer industry. Yeah, okay. Where do you work at the back? Okay, cool. All right, I'd love if you guys want to share your thoughts towards the end of the Q&A, if you have like other insights or lessons that you think could be relevant to your industries, we'd love to hear those. Any other like very consumer-facing industries here? Dairy manufacturing. Okay, awesome. Yeah, so if anything comes up for you, I'd love you to share it during the Q&A. All right, so let's get started. I think all of us can agree on the importance of understanding the customer, no matter what industry you're in. But not all of us know how the wine industry works. So, Marinda, to level set the audience, please can you give us a quick whistle-stop tour of how you gather and analyze customer data to inform winemaking and marketing activities, and what behavioral insights are you looking for in data that will help you to optimize the experience for your customers?
Yeah, sure. So first of all, First Leaf is a direct-to-customer wine company. So we are very much in contact with the customer. We know who we are selling wine to, and we get direct feedback. Wine customers are brutally honest when it comes to wine, and we love that.
It helps when you've had a few glasses.
So we have various touch points where we gather data from. Of course, the usual digital marketing touch points, how people navigate on our website, how they engaged in marketing campaigns, those kind of things. But on top of that is when you join First Leaf, we ask you to answer a quiz. And the quiz sort of sets the stage where it's like this introduction. Tell us a little bit about yourself. So we learn through that what your preferences are, what you like and what you don't like. We have a fantastic wine app called First Leaf, which you can download. And there we make it even simpler than on the website. We speak about wine styles. Do you like fruity wines? Do you like savory, earthy wine? So we try to speak a language that our customer understands. So we have the quiz data, and from that we can sort of infer what you would like. Then once you get your first box of wine, we want you to rate the wine. So our rating system is very simple. It's a thumbs up or a thumbs down. And through that, we gain insights. Are we accurate when we determined your likes? And if you didn't like the wine, that's fine, and the algorithm sort of learns more about you. We encourage you to do that. And then, of course, from that, you can leave a comment where we do sentiment analysis. And then, of course, we have the winemaking data as well, which is really hardcore, and we can get into that a little bit later, where we try and link wine chemistry data to sensory analysis and preference data as well.
I mean, wine preferences are so subjective. Like, you know, I think that's what's so fascinating about it. And Oz, your comment about like why a 30-year-old sommelier who's been in the business for 30 years loves it because you have a glass of wine, but you don't, you know, I forget what the analogy was. There we go. You're never gonna, yeah.
Yeah, I mean, the glass of wine is this much of the puzzle piece, but there's so much more about wine to know, right? That makes it really exciting.
Exactly. And so I guess I'm curious, Marinda, like how do you balance that, something that's so personal and subjective into measurable data without losing its human essence? How do you capture that?
Yes, of course. Let me just tell you how our data looks. So we fingerprint our wine and with using FTIR spectroscopy, and it's like a DNA print of a
What
wine.
does FTI stand for?
Fourier transform.
Oh, cool.
So that's like a fingerprint of a wine, and every wine is unique because it's terroir, it's varietal, it's how you made the wine, the aging that's been done to the wine in barrel or in tank, has it been on lease, all of that information is in there. So it's on a molecular level. Then, of course, we have the normal wine chemistry data. We have sensory data. We have a scoring system where we would score the wines in terms of body, fruitiness, acidity, and that can all, and we find links using machine learning to sort of get those corresponding links to the spectroscopy data. And of course, the most important is the ratings, is what customers say to that about our wines. And we find links of customer preferences. What is it in the data that they like? How we humanize that in a sense. Customers do not need to know that the acidity of wine is 7 grams per liter. A Sauvignon Blanc has a high acidity, but we'll speak in a language that it's crisp and bright. We speak the language of the customer. We meet the customer in the journey where they are, because some people know a lot about wine. If you like bold red wines, like Oz does, we'll talk to him in the sense of the heritage of the vineyard, how it was aged. But to somebody that doesn't like that type of wine or isn't in that journey, we'll make the language more simpler. So we have what we call box print and bottle print, and we'll get into those type of models later, where we meet the customer and attune language models and Gen AI to speak to the customer on their level.
Well, and how do you handle the tension between data-driven personalization and you know, according to preferences versus consumer discovery? I mean, I think of like my dad is like Bordeaux or nothing, and I'm like, I want to know if I like a Certico, I want to know if I like this, you know, crazy Albanian wine. Like, how do you balance that?
Yes, that's a very good question, how we balance that, because data can be very hardcore, and we want to bring the human inside of that. And hey, what's fun about wine is exploring. And we want to keep the curiosity of the product there as well, because if you keep that, you get more customer engagement, because that's what you want. So you don't want to send the customer the same wine every time, but we want to stay safe and then help them on their journey to explore more. So we do customer segmentation, or we call it preference clustering, where we would, based on your quiz answers and how you've rated the wine, there would be sort of a cluster. You'll fit into some cluster, but these clusters do overlap. We've, for instance, had a customer that she was very pertinent. She likes oaky Chardonnay. She doesn't want to steer away from that. But if you look at her answers, you would see, but she likes actually fruit-forward wines as well. So a Viognier, which is not a very well-known grape variety.
I love Viognier, by the way.
Yeah, it has the same weight as a Chardonnay, and some of them do have an oaky component. So she was skeptical at first, but when she tried it, she loved it. So she sort of ventured on into that preference clustering. So we keep the journey.
Yeah, I love that. Oz, as you've been listening to Marinda, and I mean, you know a lot about what she does already, like what do you think are some of the key lessons that can be drawn from wine to healthcare from your perspective?
Yeah, first of all, so cool. Are you hiring? Wait, my manager is here. I'm asking for a friend, actually. So you may think, oh, that's wine, so exciting, it's so different, it doesn't apply to us. It applies so much, even to an regulated industry like pharma, because there are no more companies in pharma where you don't engage with your customer or with your patient, right? Like, gone are the days where you have a good product and you have reps that engage with your patients and you're done. It doesn't exist anymore. You have to engage with your patients. You have to understand what they're reacting to. The patients are more and more involved in their treatment decisions. They ask the physicians, they talk to them. And I remember about 10 years ago, the physicians did not like patients who Google stuff. Now they actually do. They say, wow, the patient was informed, they asked me about this, and now we're having a really informed discussion about it. So that means you as the pharmaceutical industry, you as the company, have to understand different types of patients, what they resonate with, what is really personal to them. And that may not happen directly where they say, I like Pinot Grigio, I like blah, but they vote thumbs up or thumbs down by engaging or not engaging, right? When they see something, if they don't engage, that's a thumbs down. I don't relate to it. It does not really interest me. If they engage with it, of course, it has to be a meaningful engagement, and we can talk about that later too. But you see somebody engages with your Facebook ad, goes to your website, downloads the doctor discussion guide, you know, actually the first piece of message that you gave them was very relatable to them.
Mm-hmm. And how, given the restrictions on how in pharma we have to be very careful with how we use customer data, how close do you feel we can get to executing a first leaf type model in healthcare?
I think very close. I want to make sure, like, this is the disclaimer, because sometimes I hear people saying, I want to be Amazon. Okay, you're not going to be Amazon. You can get pretty close to how they use data in terms of how they model it, right? I'm not going to know Marinda purchased these shoes, so I'm going to recommend them this because I know you may not get there, but you don't have to. There are a lot of advanced models you can use, and Shrika, I can see you nodding. Shrika is on my team on measurement and optimization. He does this on a daily basis, right? We have these different people, different patients, engaging with different things, different content pieces on different platforms. And now you're starting to see patterns. You're starting to see, oh, these type of people that are having these type of problems are interested in X, Y, and Z type of messaging. And now with that, you iterate, and in every iteration, you get to more micro segments. I don't think we're ever going to get to n equals 1, where I know exactly what you need, but it doesn't have to be like that. As long as you feel that it's 1-to-1, even if it's 1-to-100, it doesn't matter. Because to you, that's 1-to-1. To you, that's what matters to you. To you, you say, I see myself in this message, and now I'm going to take action.
Yeah, I feel seen and heard, and yeah. trusting of the message. Mel, I'd love to get your perspective on the other big persona that we work with in healthcare. So we're not always advertising and engaging with consumers and patients. We're also, obviously, the healthcare professional, the physician is a key stakeholder. So can you tell us a little bit about some of the recent innovations or trends that you've seen at CMI that have enabled like really deep insights about preferences and behaviors?
Yeah, of course. And I think it's important to also remember that healthcare professionals, or HCPs as we'll call them, are consumers as well. So we call those the white coats off moments or the blue jeans moments. So that's an important disclaimer kind of weaving everything through. But specifically from an HCP perspective, we have multiple sources of data as well, and truly understanding, there's some similarities in what Miranda was talking about from the preferences of understanding what message they're trying to deliver to be able to help their patient ultimately. So you might need a very quick hitting piece of information, like some financial assistance that they can provide to their patients, or they might be looking for some more robust clinical information to truly understand the efficacy of the product, as an example. So we have multiple data sources that we would use. Some of it is survey media preference data, so we understand what vehicles physicians are actually using, where they're going to find their information. Some newer trends that we're seeing is using, as an example, the AIM XR data from IQVIA of understanding the research that healthcare professionals are doing online. What are they researching? What are they looking for? So that we can then pull that together across all of the different data sets that we have to truly serve them a message that will be relevant for what they're looking for when they're looking for it.
Yeah, I love that. I mean, I disclaim I did spend 2 years working on the AIM-XR data sets. I'm biased, but I think it's revolutionized HCP marketing. So, yeah. Miranda, I want to turn back to wine for a minute. So we've touched on a lot of different types of customer insights, which are obviously critical when it comes to designing effective product and marketing. But I'm super curious to know what other types of data inform your company's manufacturing and marketing outside of customer preference.
Yes, that's very important because we make wine and would like to deliver wine that the customer loves. That's for our foremost core importance to us. And to do that, we integrate a lot of different data sets that would help winemaking and give direction as to what customers like. For instance, we talked about, or I mentioned the FTIR spectroscopy, the normal wine chemistry data, but also we go as deep as in analyzing the tannins in wine, the oak volatiles, the aroma compounds, because we need to know what is it in the wine that this customer loves. They don't always have the vocabulary. For instance, people would remark and say the wine is bitter, but it's actually not bitter. If you go a little bit deeper, it correlates. They want smooth, fruity wines that's sort of easy to drink. How do you translate that? We look at the customer ratings that we put on top of that, and also the manner how SKUs are depleted. Also infers which wines are more popular, which wines resonate more with customers. And that would, all of that data sets altogether would, through AI, would infer us that there's a shift in customer preferences, or that there are certain clusters of customers that prefer a certain style of wine more to others.
Melissa or Oz can answer this one. Can you reflect on the different, actually maybe Melissa, because you mentioned it earlier, the different types of data that you're at CMI kind of thinking about trying to integrate in order to inform the most impactful healthcare marketing?
Yeah, of course. So I'd mentioned the survey data. In addition to that, we actually have vehicle data to understand through our partners where our healthcare professionals are active. From a consumer perspective as well, we have hand raiser data about different symptoms, where they are in their therapeutic categories of information they're searching for. Social intelligence, social listening, patient testimonials and journeys. Also looking at the actual campaign performance data layered on top of that. Which creative messages are resonating? Which channels are they actually engaging in?
And
yeah, if I can add, you talked about which data. I want to talk a little bit about how about data, because The reason why I think First Leaf works is not because they say, let's analyze this person for 6 months, let's do focus groups, let's ask them, let's survey them, and then send them the perfect bottle of wine. That's how we do it in pharma. We have market research, which is a very long time. We have surveys, we plan for a year, and then we try to make our campaign so perfect, right? We assume we exactly know every customer. We send them something, they don't even look at it. What we have to do is get to that level of, let's send people bottles based on this 5-minute survey, right? See if they like it. Do you like it? Okay, you like this one and this one, but not this one. Why? Let's see what the patterns are. We have to do that too. And now we can, right? Before, we could not really produce a lot of content fast. So what we did was, okay, I'm gonna have 3 banner ads, it's gonna run the full year, and we're gonna plan something else next year. We have to go to that model where we iterate so quickly, right? I know a little about you, now I'm gonna see if my assumption is correct. And sometimes it's not going to be correct, that's fine. Let's learn from that, and let's iterate so quickly that we get to that level of, okay, now I understand, based on all the data that I've seen, 25 different engagements, 50 non-engagements, now I understand what this cluster of people are looking for. That's where we have to get to.
But how do you deal with the challenge of really integrating and kind of analyzing and interpreting all of that, all of those different data sets, whether it's behavioral or response data or what have you, like in real time, to your point? Like, how are you dealing with that at Genentech?
Yeah. Okay, so I'm not going to say we're perfect, but what we're trying to do is this. Nobody's perfect, right? Except Mirinda and First.
Mirinda is perfect.
Of course. So what happens as a common problem is you have 20 different data sources that are being collected. Some of them, you don't even know why you're collecting them. Some of them you're collecting and they sit somewhere, right? And some of them you're collecting and you're using them for one thing, but they're not integrated to the whole system. What we're trying to ask right now, again, like our team with our enterprise data office is, what is the ultimate goal? Why do we collect the data? And how do they serve a centralized platform where it can give me more details around what is the next level of message or creative or copy and to which person? It's not real time. I don't think it's ever going to be real time. It does not have to be, right? Because I don't think we're dealing like in finance where you invest in something so quickly. And I know we have like finance people, but if I can give you your message tomorrow, 2 days from now, 3 days from now, that's good enough. Yeah. I think that's close to real time for the pharma industry. But again, I think the main principle is really understand why you're collecting the data and how it fits into the bigger picture instead of all these silos of 20 different pieces that don't fit together.
And what, were you going to say something?
I was just going to add, because you'd asked also from the how, to Oz's point as well, that's where, we're using generative AI and machine learning to really mine all of these large data sets, pull everything together that we have. Even importantly, I think here, is then having it be so that it can be connected to the client's data as well. So everyone can be working between creative agencies, media, and the clients to be able to see what is that next best message we want to send and how quickly can we get it to them.
Yeah, no, I love that. Just to probe on something you said, so what are some of the more, can you tell us like an interesting insight or trend that you were really, really surprised by when kind of analyzing all of the data? And
the biggest one is most of our assumptions are wrong, right? Like we assume this customer wants this. And when you look at the data, it's actually not that, right? And to me, that's the most surprising one. That's the reason why I keep focusing on iterate and iterate and iterate. The other one is physicians actually use all these digital platforms and tools more than we think they are. They are everywhere. And like you mentioned, Mel, they look at a lot of different pieces of information. And if we can get access to some of them, we can now understand what is the part of the story that the physician is missing at this moment that will help them make a really educated decision, right? Instead of giving them 5 different messages that are not connected, now you understand, okay, they consume these 2 pieces of information. The third one in their story to move them to the next knowledge level is message number A. It's about safety, right? Now is the exact moment where I need to give them that. And then you have to understand, did they look at that information or did they not look at that information? Because if they did, I don't want to keep giving you the same information if you're ready to move to the next one. So I would say that's the maybe most surprising one, which is the data is there. We just need to know how to use it.
Yep. So we've talked about customer behavioral insights and how to integrate these with tons of other data sets to deliver exceptional customer experiences. Melissa, you started touching on AI, and I would be remiss if we didn't spend some time discussing the potential and real-life applications of artificial intelligence to enhance personalization, which is the buzzword that we all love and we are all obsessed with. So that makes sense. So Melissa, how are you helping clients like ours create hyper-personalized experiences for customers, either using AI or other technologies?
Yeah, I think it starts with understanding who we're trying to reach. And to Oz's point about seeing more and more HCPs in the digital world, we have different generations of HCPs as well. So their journeys are going to look very different from people that are newly entering the field to those that are close to retirement. So creating segmentation or micro segments within both consumers as well as in the HCP journeys become really important. And then the automated media orchestration of how we're going to deliver, to Oz's point, which message are they engaging with, what are we serving them next? All of us as consumers as well are in this world of, we want to be able to search for information, find the answer immediately, get the product the next day. How can we then convert that over in the healthcare industry also? Because it's really frustrating when you are going through from a caregiver perspective or a patient perspective, or even for HCPs that want to help their patients. It's our job to get that information into their hands as quickly as possible.
So maybe I can say two things. One is about predictive AI, and the second one is about generative AI. Predictive AI, sometimes the problem we have in pharma is targeted is a good word, but sometimes we become so targeted where I heard a brand manager say, my email open rate is 90%. I'm like, how did you get 90%? Well, you're targeting 15 people that you know exactly they're going to open the email, right? Okay, is that good? That's not that good.
Why didn't you get 100?
Exactly. Then just target 5 people and get 100. Predictive AI can help us find physicians, caregivers, patients that we don't even think about, right? There's this person here. And by the way, what happens is usually you find people that are in underserved populations that are not even engaging with the medical community anymore. And those are really valuable, right, from a societal perspective. Yeah, exactly. Second one is Gen AI, right? Again, we talked about I want to engage or not engage with you so that I can understand. You cannot really create that much content within the current model because nobody has 10 times the budget, 10 times the resources, 10 times the regulatory or legal people. But with Gen AI, now you can, right? And I think that's going to unlock all those people, all these data points, and Gen AI creative is going to unlock that fast, rapid iteration.
A probing question. Has Gen AI helped you move more quickly from insight to action when it comes to actually improving campaign performance and maybe even return on investment calculations?
That's top secret. So it will. I cannot tell you that right now we have ROI data that shows us Gen AI is giving us that, but I think we're pretty advanced in our thinking. And when you're thinking about Gen AI, don't just think about a tool, right? It's mindset shift, it's the tool, it's the processes, it's the people with the skills that are going to be able to handle it. And also it's how do you re-engineer the whole thing, again, not just marketing, but also regulatory, also campaign ideation. I think we are going to see at least a few examples by the end of this year where you're going to ask this question and get a very clear answer on, yes, we have done it, and this is the result, and we're going to keep doubling down on it.
So next year, I'm going to ask you the question, and I'm excited for the answer.
After wine, please.
Mirinda, I have to imagine the data sets at your disposal can benefit from AI use cases that have it helped to really accelerate the data mining process or the personalization or what have you. Can you share some specific examples of how you've used AI or other tools to transform your understanding of your customers and deliver personalized experiences?
Yeah, of course. Our machine learning models are those that fine-tune the customer preferences, but AI gives that sort of big picture strategy where all of these data sets are combined. Examples, for instance, that I can use when we combine all those previous data sets I talked about is where you can, from a winemaking perspective, try and predict if this wine that's in the making will fit a certain cluster profile within the wine, because that will shorten, it's good for efficiency, it takes out trial and error, and you won't be 100% accurate, but there will definitely be aspects in the wine that we know the customer will love. So that's definitely a very useful tool from a production standpoint as well. We can also sort of analyze or predict the sensory impact a wine will have on a customer to some degree for sure. And and of course generative AI we use to speak the language of the customer so that they can understand what they're getting, speak in a more consumer-friendly manner about wine and not use technical jargons.
It must feel so good to get it right when you're like, we predict this customer's going to like this wine, and then you get the feedback. It must feel awesome.
Yes.
Just give everyone Barolo and they will like it. It's okay.
As I discovered, I do actually like them. So yeah. And wine consumers, I guess, we're often making emotional decisions, right? It's subjective, but data is objective. It's highly rational. How do you strike the balance between that storytelling, the emotional connection, and the data-driven insights?
Yes, we must never forget that a wine is not hardcore data. Wine is about emotions. It's rooted in romance. There's history, there's tradition involved. And where we strike the balance is that AI and data is a fantastic tool that sort of steers you in the language you need to speak to. And of course, we know our customers are on a wine journey. And as I used the example earlier, for instance, if we know a customer is well on its wine journey, it likes bold wines, we'll speak in a language that resonates with that, where a customer that doesn't like that will keep the language light and easy. So, and that's how we sort of enhance, use data to enhance it, but never forget there's the human aspect, definitely to wine, and the two go well together. The data part is just driving the storytelling.
And what is a myth about data-driven decision-making in either winemaking or healthcare that you'd like to debunk?
Oh, I love this question. I would like to debunk that, you know, there's always this thing that good wine is made by tradition and intuition, which is not true. Data, winemakers has been using data to so much to their advantage, like weather data, soil moisture, monitoring fermentation to have a little bit more control over the process. We have all this customer data. So for me, winemaking is, of course, an art and a science, but it's data analytics as well. Winemakers know how to interpret data. They just need to add that consumer aspect to it as well.
I love that. I love that you have a lab on a vineyard. It's like, yeah.
I also love, I just have to say, we also call it a little bit of art and science within the pharma industry. So we did not prepare this question or answer, so that was well-timed.
I was surprised by this question, actually. I'm like, where is that? So this is very similar, right? Some conversations I'm having with our marketing managers at this company, at previous companies, when you tell them, hey, like you have to be more data-driven, they say, I know my customer, I know what to do. A lot of people see it as I either just rely on data or I just rely on myself. And it doesn't have to be like that. You can take the data, use it, and put your own observations, your own knowledge, your own... We're all intimate with what the physicians and patients and caregivers, what do they react to? So you can use the data, but you have to be open to saying, I was wrong, right? Or sometimes you have to say, the data is actually not showing me what's right. Let me test that. Not that I'm certain about what I'm feeling, but let me test. I don't trust the data. Let's see if I'm right or not.
I just want to come in here. I agree with you all so much because we can be wrong. And First Leaf is very confident in how we analyze customer behavior, customer preferences, how we link the data to that. But we do have a 100% satisfaction guarantee. So if we were wrong, we'll replace the wine
Take
for you.
note. You don't like it, you can send it back and get a new one. I love that. I'd love all of you to reflect on the limits of data-driven personalization. Have you seen cases where too much reliance on data, as you've been hinting, I think, at Marinda, can actually lead to a worse customer experience and you got something wrong?
Yeah, definitely. You can be wrong, but I think there is limits to too much data analysis because wine is about exploration, it's about the journey. And you don't want to restrict the customer. You fit into this box, and this is where we want to keep you. We want to nudge you out of that. We want to keep curiosity, the romance of wine in there. So there's always some human decision that also comes into play. So you have to be careful that you do not limit the borders of your data output too much.
Oz, Mel?
I would say this is the reason why every company still has human beings working, right? Because if not, you just have data, you have an AI system, it just can make suggestions, it can create the content, it can activate channels, right? But we know that doesn't work. This is the reason why we talked about Gen AI. We're not thinking there's going to be a Gen AI system that's going to take the data and create the content. We want to give this power to people, for example, marketers, that are going to use the tool to make it easier for them. But in the end, they're going to make the decision. They're going to make the prompts. They're going to use the data, but they're going to analyze that. Because data on its own, it needs a lot of context, right? It can tell you 10 different things. You have to understand what it means.
I heard someone describe it yesterday that you should think of AI as like another headcount on the team or like another part of the org chart. It's not replacing anyone else. It's just basically freeing all of us up to do much more creative and interesting things with our brains. Mel, anything to add on
I was just
the
going to
limits?
say, it's similar to what Oz was saying as well, and where we don't want to put such parameters on it that we can lose another audience that we might have the opportunity to be reaching as well. If we get too micro-segmented or we get too narrow within our targeted plans of where there's still a place to be able to reach a broader audience.
Yeah, actually, that's a really good one. Really, really good one. Where are we at? Okay, 22 minutes. Before we go to questions, I'd love you all to share maybe a closing thought on the balance between being data-driven versus kind of keeping that human or subjective or emotional touch in marketing.
Yeah, I think if I can start, I can say that we want enhanced personalization. We want to make the customer feel special. We want, firstly, wants the customer to feel that we know a little bit about you without being intrusive, without assuming we know everything about you. So we want to leave that space for curiosity, exploration, and personal experience in wine as well. And that's where that balance for me comes in, definitely.
I think for now, and maybe for the next 5-10 years, human beings are still better at understanding other humans' emotions. In 10 years, I don't know. Which means when you're engaging with human beings, you need a human being to say, okay, this actually hits the right spot. Again, you use data, but you use somebody who has the human intelligence to say, this actually hits home for somebody who's struggling, going through this like illness, sickness, which is really hard to deal with, and you have a lot of unknowns. And I know a lot of our marketers are so close to these like patients, physicians, these conditions that I know when they do marketing campaigns, they feel it in their bones. They say, hey, we know these people are struggling with these things. We think if we send them this message, they're gonna actually know something that could benefit them. Mm-hmm. And again, for now, AI doesn't do that. AI can do a lot of things for you. It's not going to feel or empathize, Again, 10 years from now, it can get so good that it still doesn't empathize, but it mimics it so well that you may not need anybody else anymore. But I don't believe in that world.
Yeah, healthcare is deeply personal. We're all patients, and we all have different journeys, different illnesses that we will either want to prevent, and so we take a proactive role in that. I think with the empathy and the personal approach as well, not just from the interaction between the healthcare professional and the caregiver or the patient, it's really important to keep that at the heart of remembering this is why we do what we do. And it's really impactful, like you said, from a marketer, but from all of us working in this industry to know that we can make an impact and really change people's lives if you're able to get them into a treatment or help them heal more quickly from that.
Thank you all. We do have time for questions, so I want to open it up to the floor. Really?
I have a question.
Yes.
So, First Leaf's logo is "We make wine simple." We have a wine app where people can go into a restaurant and scan the menu, and we would recommend wines that's on that menu that would fit their flavor profile if they've completed the quiz and things like that. Is there a way, because pharma is also quite an intricate and difficult industry, is there a way that you simplify that for potential customers?
By the way, that's a great idea. We need to think about this. Scanning something to make it more accessible, that could be interesting. What we try to do is anytime we put out content, we always try to think, is this language understandable? Is this at such a basic level where anybody who reads it will be able to understand it? We don't always do a good job at it. I know we were having discussions last year about we need to ensure every single piece of information we give to the patient especially is at such a simple level where anybody understands it, right? Sometimes you see these examples of you have message to the physician, you have a similar message to the patient, and the patient is like, I don't know what this means, right? I don't understand it. I think we still have a long way to go though. I'm gonna think about the scanning thing. I wonder if you can scan something and it makes it easier for you to understand it in different words or like paraphrasing. It's hard to do, but I know, for example, what we're trying to do also to simplify, language is very important, right? And there are a lot of barriers to language. We're trying to make a lot of our content accessible. Again, that is also difficult, but with Gen AI, it's gonna get easier and easier.
I also have to say I am a First Leaf customer, so I know everything that Miranda is talking about from the ease of it. And so that's what I was thinking through of like, well, what was it like when I was going through their app with that? I actually think that we do that quite a bit, maybe not in more complicated, complex conditions, but when you go through from a symptoms tracker perspective and you're updating, like, these are all the things that I'm experiencing, what are some of the options for me? And something could be topical, something could be an injection, something could be a tablet. What is my preferred method of receiving? So there's different varieties where I think we're getting closer to that. I haven't seen it executed quite perfectly like it is on First Leaf, but maybe we'll get there.
That's a free bottle of wine for her, right?
I also heard it on the grapevine that Miranda has a surprise.
Yes, I have a surprise for everybody if they want it. So I have on this card here, I have cards for everybody, is a QR code that you can scan, download the wine app, scan this QR code, you can answer the quiz on the website or on the wine app, and you get a huge discount on a box of wine at your preference that will suit your preference.
So stick around till the end and come and grab a scannable QR code. Any other questions? Oh, yes. Hi, Carly.
Hello, if you can hear me.
Yes.
I wondered if you could talk about the data and the complexity of the audience, because in healthcare you have physicians and patients and caregivers. In wine, you have the customer, but then maybe you have a sommelier or you have other influences. So I'm interested to hear a little about that.
Okay. In healthcare, I think this is the biggest challenge. For example, when you do a campaign and you try to understand how effective it has been, it's so hard, right? Because what happens is, for example, you reach a patient. Let's say the patient clicks on an Instagram ad. You know that. Let's say they go to your website. You know that. Let's say that they download a doctor discussion guide. You know that. Okay, so now comes the complexity. You don't know if they went to the doctor, right? You don't know that. You don't know if they talked about something. You don't know what they talked about if they talked about anything. Even if you knew that, let's say you know, patient goes to the physician, they talk about X, physician says, okay. You don't know what insurance says. Sometimes they deny it, right? And now you have to switch. There are so many gaps in between where you're not able to say, okay, I made this and that led to this sale. However, by using different methods, that could be A to B tests, that could be, I'm just gonna run something in this region and see what it does. By actually combining different, let's say, mathematical methods of going to the customer, you can understand patterns. You have enough data, but then you can understand, and you have to combine it with real-life market research, for example. Oh, now I know I did this thing in Texas, and I know in Texas, the amount of people that talk to their physicians increased by 5%. Great. If it's just in Texas, that correlates to my program. Now, the physicians in Texas can tell you, hey, if somebody asks for this, 20% of the time, I say, okay, great, now you have that data. And then you have the sales data. You can start to like stitch together different pieces. Is it difficult? It's really difficult, but can it be done? I think it can be done. You just have to be really intentional in how you design the whole, let's say, system.
Yeah, with us, to some degree, it's easier because in the quiz, we ask where you are on your wine journey. Are you adventurous? That would mean, yeah, I am. So it opens up more wine preferences, of course, for you. Or no, I'm not, you know, I don't know anything about wine. So we know that about you, but there are people that don't want to answer the quiz. They just would like to say they like fruity wines. So, and we, of course, when you rate the wines, and that's why we encourage engagement so that we can get to learn you more, learn you better. And then, of course, with generative AI and how we speak to you, when you open your box of wine, it will say, hi, Nicola, because we know that you like bold red wines. This is how your box looks like. So we speak directly to you because no person's box is the same. It's really a personalized box, and within that, there's a message in there, how we communicate and why we chose these wines for you. So for us, it's quite easy to differentiate.
I'm very excited for that box. Any other questions?
I just thought I'd add to that, listening to Oz's description of trying to connect with the ultimate consumer. It's very parallel to the three-tier system for alcohol, and someone here for beer can speak to that as well, where the winery will create a wine, put it through a distributor into a retail or a restaurant. They don't actually have the kind of the virtuous cycle, if you will, of the feedback from the actual consumer. So they have to infer a lot of that through the sales, A/B testing, marketing, promos, whatever, NCAPs, things like that. And that's why I love that First Leap is direct to consumer, because we can close that loop. We know who is actually consuming our wine. I can't imagine that's feasible in the healthcare industry and for the privacy. So.
That's true. Also, by the way, my neighbor owns a winery in Napa. And, okay, it's not like First Leaf, right? Because, like you mentioned, he's saying, for example, hey, my wine is not in a lot of restaurants, and I don't know if people are asking for it. He doesn't have access to that data. You do because of your unique positioning, I think, but a lot of industries are dealing or grappling with the same problems.
Yeah. And while it's not possible when we're thinking about patients, it is possible with with physicians, right? We do have, in many cases, opted in one-to-one level information about HCPs and the journeys that they're on. So, yeah, maybe we'll never get there with consumers in healthcare for the right reasons, but it's, yeah, we are getting there. Yes.
A question from Marinda, to another complexity. We talk about wines in terms of flavors, like this. But how do you collect and help customers understand the situational difference in liking wines? I like one wine in an afternoon versus in the evening, dinner versus a cocktail wine. I live in Michigan, and so having wines in the afternoon in the summer is way different than what I'll have in a dark fruity day. So how do you collect that data, and how do you help the customers?
If I understand the question correctly, if I can repeat so that I know I'm answering you, is that you're asking how would we know for what occasion a wine is being used for?
Or the situational aspect of preference, or
Yes, that's very difficult because data doesn't know that. Data doesn't know what time of the year it is either. So we would, when we talk about the wine, we would suggest what occasion this wine would go with. We suggest food pairings, but that is not in the data, and I think that's where the human aspect of that comes in. Yeah, did I answer that?
I think so. I guess I could offer that if somebody said, I like this wine, we can follow up with a question. If when did you drink this wine? Or if they said they didn't like it, you might ask a question too about the situation that they were.
Yes, because I agree with you, because mood and occasion definitely influences how you feel about wine. So when we do a wine, when we dissect wine ratings, and we've had debates about this so much, it's not a clear-cut data point. You have to use also your intuition when you look at the data. And some members leave review comments where we do sentiment analysis on, because they'll thumbs down a wine but have a positive comment about it. You know, so it's not, you have to use...
how do you explain that? They just did the wrong thing? Or?
No. They would say, I like the fruitiness of the wine, but the wine was too tannic.
Okay.
So they would thumbs up, but the comment will be negative. You know, if you do sentiment analysis, you sort of get the negative, positive of that. So yes, it is difficult, but that's why we can never take the human intuition and interpretation of data out of it.
Yeah.
Thank you.
Thinking back to like the old days of SEO, obviously you would try to influence how you ranked on SEO, and I wonder for both wine and for pharma, with AI, are you trying to influence the models and what it says about your products?
Yes, it's very difficult, especially for a pharma company. I think it would be easier, for example, for a Mayo Clinic, where you have so much information, so much content that you're launching all the time. This is the reason why also the pharma industry, especially manufacturers, as you know, are relying a lot on SEM, because we are not able to compete with like the WebMDs and the Mayo Clinics of the world, because you know, if they have an article about something, they're always gonna rank higher than us. So we are rethinking SEO. We are also rethinking SEM. I don't think we're at a point where we have so much power and content that we are able to influence them to the level that we want. But that doesn't mean we're ignoring SEO because there's AI, because as you mentioned, the models are being impacted by everything that's out there.
I cannot really speak about SEOs. I'm going to ask Carolyn. She's our Chief Wine Officer. And I know we're busy with an SEO project. So Carolyn, I don't know if you have any views on that.
I mean, as you can imagine, if you search Cabernet Sauvignon, we are not going to be on the top of the list. It's a very crowded field and it's hard to cut through. And there are a lot of other wineries with way more marketing spend. They can really promote themselves as the quintessential Cabernet source, if you will. And so we are embarking on SEO, looking for, if you will, the zeitgeist combinations, right? And so we're not going to go after the things that maybe have the highest hits, but we are starting a program where we're looking at the hits that had, or the inquiries that have had fewer results, right? So I'll use an example. Apparently, a lot of people want to compare, Chardonnay with Pinot Grigio. So there's a number of sites there, Wine Folly, as you had some of their materials previous, talks a lot about that. And there are a number of other wine consumers or sommeliers that will discuss Chardonnay with Pinot Grigio. But they aren't comparing Chardonnay and Sauvignon Blanc. So is that an opportunity to bring some information that has been underserved because it's a combination? Another example might be, in Spain, in Barcelona, La Sagrada Familia is coming up with an anniversary this year. There's not a lot of wineries that are going to make a connection of like La Sagrada Familia and Spanish wines and Riojas and Tempranillos. And how can you kind of capture the essence of that sort of an experience? And so it's a little more creative, and that's where AI and Gen AI is helping us to take a look at the unusual combinations and try to rank there. I mean, it's a tricky world, and it's shifting very quickly because of Gen AI for sure.
Super interesting. How old is the Sagrada Familia going to be this year? Is it 100?
125.
125. Oh, I should get that right. I'm European. All right. Any other questions? Yeah?
I know we talked a lot about different types of data, and I'm curious about some of the more untraditional data points and how we might use that in healthcare or in wine. For example, weather, right? Personally, I would prefer more red wine when it's more rainy or cold, but when it's warm and sunny, I might go more white wine or bubbles. Similarly, in healthcare, weather can influence our mood, like depression could influence migraine, could influence rheumatoid conditions. So weather being one of the untraditional data points, but how are you thinking about those types of data?
We have an AI model that incorporates a depletion curve that looks at how SKUs are depleted throughout the year. And through that, you can infer that certain times of the year, certain wines will be more accessible to people than others, or preferred rather. And that can be combined with a marketing strategy as well. So that's how we currently do it. I agree, perhaps when it rains and weather data, it is difficult, but you get a mixed box of wine normally if you like red and white wine, so you have a pick.
Yeah, and we absolutely use it within healthcare as well to be able to follow certain conditions that might be more prevalent within cold, wet times of year. And to your point about different therapeutic categories where it's a known correlation between climate and when we're seeing spikes within certain conditions.
I will not detail this too much, but there is even potential to use zip-level sewage data that are being tracked by some companies, and then do your marketing accordingly.
How?
Can track certain diseases within the sewage so that you can understand what's happening within that region.
That's gross.
And cool at the same
And
time.
cool.
But it's also very cool.
Another aspect as well is testing data, lab data, to be able to understand what screenings are occurring, and then what course of action the doctor might take next with that patient.
Yes, absolutely. Any other? There was one more hand up here. Yeah.
So, Ross mentioned this earlier about there's like a lack of data in underrepresented communities. How do you fill those gaps? And similar to like the wine industry, there might be some underrepresented farmers or vineyards like throughout the world. How do y'all fill those gaps and those voids to make sure that the output that y'all are putting out also integrates those people and communities?
Great question.
Okay, so on the wine app, for us to give you correct information, if you're in a supermarket and you scan a label of wine that's not a first leaf wine, we have over 1 million wines in our database. That's hopefully representative of the most popular parts in the world. So we make sure our database is very big. We don't per se go so much into vineyards, but the wine that we analyze and the FTIR fingerprint, all of that information is embedded in there, and we can correlate that to the information we want for sensory, predicting sensory impact. Are we on the right winemaking track for these wines, and will it resonate with our customers?
And from a healthcare perspective, I mean, there's tons of innovative ways you can predict patients or transitions of lines of therapy and things like that using all different kinds of data sets. So we talked earlier about, in rare conditions that often affect underserved communities, like, you can use social determinants of health, for example, as an input to some kind of AI/ML powered model. We could talk about that for hours, to be honest, but we've just run out of time, and I've got the red light flashing. So yeah, happy to talk more offline. All right, well, thank you all so much for sticking through the post-lunch wine panel, and thank you to the panelists.